Hi, my name is Faheem Sheriff. I'm a neurointensivist and a neurointerventionalist and an assistant professor of neurology at Texas Tech University Health Sciences Center in El Paso, Texas. Our study, which was a Get With the Guidelines study, focused on endovascular therapy disparities according to race, ethnicity, and trending these disparities over time. The reason we looked into this was endovascular therapy is now becoming the mainstay for treating large vessel occlusion strokes. And this was after five major trials were published in 2015 showing that removing the clot mechanically in the blood vessels, the large blood vessels supplying the brain, resulted in significant improvement in outcomes. And what we wanted to answer was whether there was a difference pre-publication of these major trials in 2015 and post-publication in terms of race and ethnicity affecting endovascular therapy utilization as well as outcomes. We know from previous studies that stroke care has had disparities, and certain ethnic groups have a lower likelihood of receiving certain acute stroke therapies. We focused on endovascular therapy, and we found that there are disparities. For instance, Black patients were less likely to receive endovascular therapy compared to their non-Hispanic white counterparts. This disparity fortunately narrowed comparing pre-2015 and post-2015, but the disparity was still there. It was still significant when we looked at this large Get With the Guidelines cohort. Other very pertinent findings were that if you looked at minority patients, namely Asians, Black patients, and Hispanic patients, all of these patients had a lower likelihood of dying in the hospital or being discharged to hospice compared to their non-Hispanic white counterparts. But then when you looked at the 90-day mark, outcomes were worse in these minority groups compared to their non-Hispanic white counterparts. And so that was, I think, the most surprising finding from this study. So even though immediate outcomes seem to be better in these minority groups, long-term 90-day outcomes seem to be worse. And so that was another finding that we expounded upon and hypothesized and came up with certain potential explanations. I think in general, the message for the scientific community is these disparities are still there. We are making progress. We are closing in on these disparities, but we still need to do focused research to find out why they persist and how can we then narrow them and close them completely. Secondly, we need to focus in on structural systemic factors that allow these things to persist, and then provider level bias that may exist either in the medical providers themselves or paramedical providers as we are providing care for these stroke patients. Because if we do not understand these implicit and explicit biases, then we will not be able to address this problem completely. So I think while there is some good news, there is a lot of work that remains to be done. Thank you very much.